Good evening. Welcome to the 193rd day of the Swasthya 365 days project. Today we are going to see about the treatment and overview of hemophilia. Treatment. Hemophilia is treated with replacement therapy. This involves giving or replacing the clotting factors that are too low or missing in a patient with a condition. Patients receive clotting factors by injection or intravenously. Clotting factor treatments for replacement therapy can be derived from human blood or they can be synthetically produced in a laboratory. Synthetically produced clotting factors are called as recombinant clotting factors. Recombinant clotting factors are now considered the treatment of choice because they reduce the risk of transmitting infections that are carried by the human blood. Some patients will need regular replacement therapy in order to prevent bleeding. This is called as prophylactic therapy. This is typically recommended for people with severe forms of hemophilia A. Other receives a demand therapy, a treatment that is given only for after bleeding becomes and remains uncontrollable. Complications from the treatment of hemophilia are possible, such as developing antibodies to treatments and viral infection from human clotting factors. Damage to joints, bones, muscles and other parts of the body can occur if treatment is delayed. Other treatments of moderate forms of hemophilia A include desmopressin, a man-made hormone that stimulates the release of stored factor VIII, and antifibrinolytic medicine that prevents a clot of breaking down. In 2013, the US Food and Drug Administration (FDA) approved Rcsmc, a purified protein created recombinant DNA technology for patients with hemophilia B. Rcsmc, a lab-produced blood factor IX, aims to prevent the uncontrolled excessive bleeding by replacing the clotting factor by missing the low levels of hemophilia B in patients. In future, gene therapies may be available. People who wish to join a clinical trial and contact a National Heart, Lung and Blood Institute (NHLB). Good quality medical care of doctors and nurses who know a lot about disorder can help prevent some serious problems. Often, the best choice of care is Comprehensive Hemophilia Treatment Center (HTC). And HTC not only provides an address to all issues related to disorder, but also provides a health education that helps in people with hemophilia stay healthy. Now we are going to study about the inhibitors. About 15 to 20% of the people with hemophilia develop an antibody called an inhibitor that stops the clotting factors from being able to clot and stop bleeding. Treatment of the bleeding episodes become extremely difficult and cost of a care person which can inhibitors skyrocket becomes more clotting factor or different type of clotting factors needed. People with inhibitors often experience more joint disease and other problems from bleeding that result in reduced quality of life. Now we are going to see how to live with this hemophilia. There is no way to cure hemophilia, but there are ways to reduce the risk of excessive bleeding and protect joints. These include regular exercise. Avoid certain medications such as aspirin, non-steroidal anti-inflammatory drugs often called as NSAIDs, and heparins which are blood thinners. Practicing good dental hygiene. As preventive treatment, as prevention is better than cure, a patient may receive regular injections of an engineered version of the clotting factor VIII for hemophilia A and IX for hemophilia B respectively. The Centers for Disease Control and Prevention (CDC) recommend regular testing of blood-borne infection like HIV and hepatitis and vaccination against hepatitis A or B. People with hemophilia who receive donated blood products may be at high risk of developing this disease. Hemophilia treatment centers (HTCs) are available for support. A CDC study of 3,000 people with hemophilia found those who have used HTC were 40% less and likely to die due to this complication and later due to this condition. To protect against injuries, there can be extra clause of bleeding. A person can wear a padding. Extra care is needed when participating in sports or high impact activities. Thank you.